Good evening, everybody. I am bringing all of our panelists over to our webinar now from our backstage area. I know Zoom got fancy now. So all of our panelists should be joining from backstage pretty soon here. Welcome to all our attendees. I know you guys are joining in right now. Apologies for being a little late, but we wanted to make sure we were ready and we're on our A game. So thank you for joining us on our Road to Residency panel. This is our neurology specialty panel. This will be recorded and posted to the YouTube page in case some of your friends ask about it. I know we're a little late into the ERAS season, but better late than never. My name is Dr. Lovinani. I am the professional board member to the EC for the SNMA. Also, I'm one of the Tour for Diversity mentors. So this overlap has just been great for me. I am in emergency medicine, which does like this much neurology. But I am here to just be a moderator, a facilitator, and make sure we bring all of the A game that you guys need, all the best tips and tricks, and make sure that you guys go into application season confident and come out to the application season with a place, because that's what we all want. We're going to go around and introduce everyone one by one. And then we're going to hop into it. Do not be afraid. You can even start dropping your questions in the Q&A or the chat if you want to right now. We're here for you. Dr. Onoyibo, if you don't mind going first. And then I'll go around and have everyone else introduce themselves.
Yes. Hi, everyone. My name is Sharice Onribo. I am currently a fourth year at Emory. And today was our match day because I'm going
True.
ship. So I'm going to be matching into movement. I'm going to UT Houston. So yeah.
Yay.
Thank you.
H-Town. I'm from Houston, Texas, off of
Same.
59 and Beltway 8. You know what I'm saying? So for all the Houston people out there, you'll be getting a great doctor coming to your area. Dr. Daniel, if you don't mind introducing yourself and what you're into.
Yeah, what's going on, everyone? So I'm Philippe Daniel, also at Emory. I'm a third year resident, so yeah, still deciding what I want to do long term. But lots of people do neurohospitalists, so I think that's actually what I'm going to do. So,
look, we need y'all. I need to consult somebody in all these stroke alerts I be getting in the ED. So don't be afraid to hop in that pile there. We would love to have you. And Dr. Akinsanya, if you don't mind introducing yourself and where you are.
Yeah, definitely. I'm Maima Akinsanya. I am a very newly minted assistant professor at Georgetown, and I'm based out of one of the satellite hospitals in Maryland. I did my neurology residency at Emory. That's why we are all Emory folks on the call. But yeah, excited to be here.
Thank you very much. And if I had to use my crystal ball or my memory, I would venture to say that a lot of our attendees right now would not mind going to Emory. So you guys are probably the perfect people to talk to and the ones that they want to hear about. So we'll definitely be going into there. Looking at some of our attendees, just so the panelists know, I see that we have SNMA board members on here. I see that we have mentors on here. I see that we have a lot of special people. So we're going to make sure we bring everything out to them. So I'm going to start with the standard questions that we have. And again, people feel free to drop your questions in the chat and we will answer them live. So standard question number one that we tend to get a lot is, how should our students currently be shining on their sub-Is? Should they have their own reflex hammer in full bag? Should they know all cranial nerves backwards and forward? What tips do you guys have to shine on your sub-I? And I'd like to hear from all three of you guys because they need these tips. In any order is fine.
I can go first since I don't know. I remember my sub-I very vividly. I think that the best way to shine is, of course, yes, definitely have the basics. Like you don't need to have a whole bag, but at least have reflex hammer with you. I didn't have a tuning fork, but at least the reflex hammer, definitely have that with you. You don't need the little, you can still have the triangle, the tomahawk looking, but on the regular one, you can buy the $10 on Amazon, really nice. But I think the best way on it honestly is to show an initiative, but more importantly, take full ownership of whatever patient that they give you, and come up with plans. Just make sure you're showing that you want to be there And even after rounding, is not that you're, afterwards try to figure out different ways to help out the other people who are also on the rotation as well, on patients that may not be the ones that you're taking care of. And always ask, questions here and there, on your patients on further, like, an assessment of the plan. So you can say, oh, I saw this patient and this is the plan. And then just, have 1 or 2 questions a day that you have. And, as long as you're showing that you are engaged and the questions that you're asking are showing that you want to take it one step further, I feel like that will show a lot of commitment, and it will reflect well on you.
Like that.
Yeah, I agree. I always tell students to really try and act like you were the intern, even though you're the medical student, but try and put yourself in the mindset of, if I was the intern, how would I manage this patient? And just to the best of your ability. And, the things that you don't know, you're not sure about, that's how you're able to, you could ask your resident for help with that. But that really will show that you're taking initiative and that you're trying, and you'll grow more that way in your medical journey versus just kind of doing the bare minimum. So trying to come up with your own differential diagnosis, not just looking at what, the note said from prior, if you're picking up a patient that's already been worked up. Try and look at a case with fresh set of eyes, and information that sometimes the residents or the attendings are not as fresh as, so it is possible that you can bring something new to the table. And like Sheree said, ask lots of questions, show that you're thinking about the case, and genuine questions, not just questions for the sake of having a question, but genuinely think about things. And when you have questions, ask them. Don't be scared to ask them. And I always suggest, like, if there's, if during rounds there's a case that's challenging, and, even the attending is like, oh, I'm not really sure how to manage this, try and look it up, look up journal articles, looking up to date how to manage whatever the specific scenario is. And if you're able to find a decent answer, or at least be able to say, oh, there's not a general consensus, but this is what most people are doing, then offer to present that, as a short presentation. It doesn't have to be some 30-minute PowerPoint, but you can put up, even a 5 to 10-minute presentation that will be super impressive to the residents and to the attending. Again, it's showing initiative, it's showing that you're thinking about things and that you're really, really interested in the subject matter, and you're going basically above and beyond what the average medical student would do. So that is a great way to, get you noticed and let people know how committed you are to the field.
I like that. I like that. Dr.
Yeah.
Daniel?
So yeah, I mean, the stuff I have in mind is kind of so basically in the same vein that what Maima and Sharice were talking about, but you are there to learn, right? You're obviously not going to know everything, but it's a lot more impressive when a student or a sub-I has shown that they've learned something versus someone who knows everything already, I guess. But yeah, you have to show that you were able to go from point A to point B. You're there for a reason. You're there to learn. So again, presenting like a short case or something, or like a what you learn on a patient. Let's say you had like a really nice case. You can definitely, do a short presentation on what you learned, or like a specific pathology that people might not encounter as often. And the second thing is, yeah, so as a PGY3 now, third-year resident, what I'm starting to do is I'm kind of putting myself in the shoes of an attending, because I'm about to be by myself soon, right? So I'm trying to, make decisions, by myself more, and just to get me ready for that next stage. So as a sub-I, you also kind of, start thinking about that too. What's going to get you ready for the next stage, AKA start thinking like an intern. And in turn, when they see that you're starting to think like an intern, then that's also very impressive. So yeah.
All right. I like those topics. That makes a lot of sense.
We've got
we're
you
back.
Yes.
We got you back.
My computer died. Just died on me. It's okay.
It happens. One question I was gonna ask to everybody. I know in EM for us, I'll say what the things are, but what are some things that you guys feel like sub-I should walk in and you guys are like, we're not teaching you that. You should know that by now. In EM, it's like simple sutures, right? Like, granted, maybe you go to resident and watch you do it one time, but I'm not watching you do 10 sutures. Like, you should know that by now. you know, everyone can't read EKGs. That shouldn't be done before you come to EM. But like that really bad STEMI, that really bad heart attack, that's obvious. We want you to know that. Is there anything you feel like sub-I residents or sub-I students should walk in? It's like, y'all got to know that. We can't be teaching that on day one.
I would say cranial nerves, because that's like such med school bread and butter. And so if you know, you should know what the cranial nerves are, where they originate. You don't have to know each branch and you know a lot of detail, but you should know like the foundational things about cranial nerves. And you know, if someone comes in with a stroke and someone asks you what cranial nerve is affected in their face, you should know that, for example, like how to clinically apply it. Again, not super detailed things, but honestly, you learn cranial nerves the best in medical school. And then after that, some of the details you really have to refresh on. So it's like the medical student should be able to teach the residents about cranial nerves.
That's a fact. I know there's 12 of them, and I think I can name like 5. So I get that. Anything else for our other 2 panelists that you guys think med students should know on day one on sub-I? Like, don't walk in here asking to be taught.
I was gonna say the neuro exam in general, like all of the steps of the neuro exam, not necessarily the fact that, you know, you can get your reflexes all the time, but like at least know the general area, you know, for that kind of instance, but just know the neuro exam kind of down pat and the different questions. You know, I think that one is good. I would say that knowing just the basics of stroke as well, I guess, is something that is helpful, like the different etiologies and things like that. I wouldn't say they need to do more esoteric things, but just the basic of strokes. I think that would be good to know too.
Dr. Daniel?
So when it comes to presenting, you know, this is not medicine. We don't have to go over the patient's entire history and whatnot. You know, we're very neuro focused. If it's relevant, then definitely bring it up. But we're not trying to hear about like respirations and stuff. Like, nah, you know. But so yeah, try to be focused and talk about what's relevant. And if it's not, then it's not. So yeah.
This man said we don't care about breathing. Not over here.
Oh, speaking of relevance and things like that, I would also say that knowing how to present, that is something where I feel like, you know, as um uh a med student and intern is something that everyone is learning how to do, but at this point, whenever you're a sub-I, you should know at this how to organize your presentation and where you're supposed to put things and things like that. So that's very important that you should know by that time.
Interesting. Quick question to you guys. I know a little bit, everyone's taught basically from med school, the SOAP, right? Subjective, objective assessment plan. In EM a little bit for some of the right in the department cases, they've been pushing SBAR, right? What's the situation? What's the background? What's your assessment and recommendations? It's pretty similar, but you're supposed to kind of hit the highlight off the bat. Like, you know, Miss K is here for chest pain and her EKG shows this. It started 5 days ago. Has that changed in neurology, or do you guys still feel like you're kind of on the SOAP, like, hey, we want everything, give us the objective, you know, go step by step by step?
Yeah. So I'll say, so I mostly use the SOAP, but it's also because, so yeah, we talk about the history, we talk about the exam, and then we talked about labs, but then we might pause to look at the imaging together as a team, as in does the story and does the exam kind of fit, you know, this imaging that we're about to look at. So in terms of, you know, learning how to read CTs and MRIs, we kind of do it within that layout. So.
And anything on the CT or MRI you guys think a sub-I should be able to point out? I think the answer is okay if it's no, but if it's like a hemorrhagic stroke, guys, point that out, versus like the teeny tiny lacunar one. All right, it's okay, you didn't get that on MRI. Any pearls you'd like to drop for them here that they should be looking out for on imaging?
Yeah, because I know in med school you learn what blood looks like on CT and what an infarct looks like. So I definitely do think that sub-I should come in, you know, knowing what a hemorrhagic stroke versus an ischemic stroke looks like. Bonus points if you're able to identify the territory, you know, like is it MCA, ACA, PCA, that type of thing. And I feel like I would know at least MCA strokes because those are very, very common and what you're likely to see in terms of the bread and butter cases. And with MRI, you should know like DWI, what a stroke looks like on DWI. And just they're always going to ask you about like flare, T2 versus T1 and what you see on. But I know that that's something you learn, but that's something you should also bring in, not something that you memorize for a test and then forget about it, but you should, be ready to explain those things. And I feel like I have asked those questions and I've also heard a lot of other people ask like, okay, what do you see on T1? What do you see on T2? Those are just, they're common questions you're going to get asked for like MRI.
All right, y'all, go and look up those MRI definitions. Not Ric Flair, but T1 flare, T2 flare. Go look those up. And figure out what you need to bring to the table because they will be asking about that on your sub-Is. That's what we need. All right, let's dive into the application a little bit, right? So they're all in the middle of the season. They're going through everything right now. I'm going to ask you guys some pretty common questions that most people by now on September 12th have probably already done, but I think hearing it from you will solidify that they did right. So let's start with the biggest one that probably every med student out there is dreading, the personal statement. Do you guys have any tips and tricks on a neurology specific personal statement? Should everyone be talking about how Mima had a stroke and now they want to be a neurologist? Or do you guys kind of like say, we want to hear about you? Like, don't give us that, bread and butter personal statement. Any thoughts, especially if you have any Emory specific thoughts? Again, I think our attendees would love to hear about that.
Yeah, I've sat in on plenty of the meetings in terms of reviewing applicants just during my chief year at Emory. And I can definitely say the whole, your grandmother having a stroke or your grandmother having Alzheimer's, although that is, I'm sure, very impactful to you and your family. I'm, by no means trying to make light of it. It's a common situation that people tend to talk about. And I think a lot of times people can kind of find it to be just not as interesting or impactful as maybe a different situation. Like I've heard people talk about maybe their mother had MS and how they became a caregiver. That's a little bit more unique. Not that, and again, for your specific family, it's all burdensome, but for people reading hundreds of applications, like the fifth grandmother with a stroke or the fifth grandfather with Alzheimer's is just doesn't usually like reel them in. But definitely talk about yourself, talk about why you like neurology. I think that's big. I think people want to make sure that you actually like the field and you find it interesting. So, talking about why you find, your intellectual curiosity with it, like you enjoy, learning about the cases. I remember my personal statement, I was like, this was the one rotation that I went home and I was most excited about reading about, and I wanted to come back and implement what I read, that type of thing. So I feel like people want to make sure you actually like the field for reasons other than, the aforementioned, but you just find it intellectually stimulating. So those are some points I would put out there.
I like those points. From our other panelists, we'll take all the points. Please rain them upon us.
Yeah, I mean, I agree with what she was saying. I think that for me, like, I didn't necessarily have some life-changing event, but I do think that if whatever you're talking about, if you can have like a different lens to it, sometimes it can make it a little bit more make it stand out more. So for instance, like for me, my whole thing was centered, and it still has been, to be honest, has always been centered around like health disparities and trying to bring more of awareness to that in specialty fields. So I think that, and that's kind of how I tailored my personal statement as to, yeah, I had a family member who had, seizures, but, the way that we kind of dealt with it kind of echoed A, lack of knowledge, and B, the healthcare disparity. So then that's how I, understood this, learned this, and kind of move forward with that. And I think that that's something where, sometimes people kind of it's more of my why neurology as opposed to like why medicine in general. So I think that whenever you're talking about yourself and your personal statement, if you're able to mainly say why neurology, and it's something that kind of is solely applicable or more applicable to neurology versus medicine in general, I think that might also be helpful, because I mean, we all want to help and take care of patients, but like why specifically here? Other than like, oh, the exam was cool, you know.
I know y'all like the exam. But yeah.
I'm guilty.
Dr. Daniel?
Yeah, I don't really have much that I would add. Just that, the vast majority of personal statements, they're not necessarily going to hurt you or help you too much. It's only a small percentage that actually like, whoa, this is, this is like a spectacular personal statement and we really, really want this person here. This doesn't necessarily happen that often. However, if you don't show, why you're passionate about this and why you want to become a neurologist and the reasoning behind that, then that's where it can put you at a little bit of a disadvantage. But yeah, no, people want to see, or people want to work with colleagues that are passionate about their work, and I think that's what it comes down to. So yeah.
All right, try to display that passion in the personal statement. Try to get off the neurology. Those are the tips and tricks that I am hearing. I think especially in 2023, especially the students I've worked with, hearing that disparities portion, I think is like really, really, really big. To know that, oh, I can let that part of me out in my personal statement. So I think that's pretty awesome to hear.
Can I add something else really quick?
Oh,
That
please.
like, it's related to personal statements, but you can also bring it into like interview season and whatnot, because I know it sounds like a lot of people probably already wrap that part up in terms of personal statement. I always tell people like, what are you bringing to the table and like what makes you unique and an asset? And first you have to believe that about yourself, honestly. And you have to believe that you are valuable, you're an asset, and that, a program is going to benefit from having you there. And I think if you're able to, number one, believe it for yourself, and then two, articulate it, that can come across really well in a personal statement or again in interview season. And if you need to like ask your friends and family and the people who know you, because I know sometimes it can be hard to like, speak well of yourself, or well, that sounds bad, like you speak terribly, but hopefully y'all understand what I'm saying. Sometimes it can be hard to kind of brag about yourself, but it's necessary, honestly. And so like if you were the lead of an organization in med school and you guys started up new programs and did a lot for the community, or I'm trying to think of other things people have told me that they did that were like outstanding. Like don't minimize those things and just put it as a bullet point in your ERAS application. Like highlight them and talk about them and highlight that, your leadership skills or your team building skills, or, how innovative you were and you thought of something new, whatever it may be. Just don't be scared to talk about those things, to highlight them, because honestly, those are the things that the program, when they're, having their little meetings and talking about, that's what they're going to highlight and they're going to be impressed by. And it's, if they don't know it, then they can't, be impressed by it, so basically just making sure that you're bragging on yourself and what you've done, because I'm sure you've all done like amazing things, but it can be easy to be like, oh, well, I included it in my organizations, they'll see it. Like, no, highlight it, talk about it, and it does go the long way for you.
I used to give the advice, if you don't know the good things you've done, go find your mother or your auntie or your grandmother and be like, what do you think about me? And they will always hype you up. Best hype people on the planet, hands down. So definitely I love that advice. Go talk to family, get some inspiration on what to write. Because you are correct. A lot of people will leave those personal statements lacking. And that is your time, everyone out there, to just knock it out the park. Hit it with us, get there. And so people don't feel bad if you remember about how many drafts did y'all go through before you were at your final one. I think I had like 4 or 5 before I was done.
Yeah, like 8, 10. In fact, I had like 3 different versions, and I was just like, which one do I feel great about sending at the end of the day? Like it was bad.
Everybody
Yeah,
else,
a lot.
do you remember?
I don't remember how many, but I just know I probably agonized over it because that's just how I am. And like writing is like, I don't know, big for me. I just want to tell this like marvelous story. So it's also like a personality thing. But, like Philippe said, honestly, it's like not the biggest thing in the world. It's not going to make or break. It will break if it's like super lackluster. And it might help make if it's like phenomenal, but that's like the very ends of the spectrum. Most people fall in like that middle category. So don't let it be like a stress point, because it probably is not going to tank you.
All right. Do y'all hear that out there? Stop stressing about the personal statement. Just get it to a good enough point to turn in, and then turn in. So I joked on the flyer, and it's very, very true that neurology is the most cerebral, boom ching, of all the specialties. But cerebral means brain. So I'm an old head now at this point. I've accepted it. When step 1 had a score back in the day, and step 2 had a score too, but it was like way on the back burner. I mean, people used to like apply and go on interviews before even taking step 2 because they wanted to hide that score. Nowadays, step 1's pass fail, and people are moving up their step 2, taking them so much earlier. At Emory or even at Georgetown or anywhere amongst y'all friends, have you guys heard of that magic number for some programs? Have you guys heard about what you think people need to be scoring to be quote unquote strong applicants? Or does it appear that it's pass and then apply and we'll see you on the trail? Here we go.
I haven't heard of a new magic number in the current landscape. Like, I'm just saying, general neurology tends to be a little bit more forgiving than some of the like super ultra competitive cutthroat specialties. No matter what specialty you're applying to, like top programs want good numbers. That's just the culture. I don't know when that's going to change. But I think one should not focus on it as it being the only part of the application. I feel like neurology programs in general tend to be a little bit more holistic versus like, I know some of the surgical specialties, it's like, if you don't have a certain number, they're not even looking at your application no matter what. But yeah, I don't know if you two have heard things.
I haven't heard anything, but I can speak to me. My step abysmal. Like, it was terrible. I mean, I passed, but it was terrible. So because of that, I took step 2 before I made sure to take step 2 before I was applying. So that's why, like, with my whole, I do agree that it's more holistic, because I mean, yeah, I got into Emory, but it wasn't like I didn't get interviews along the way because my step 1 was poor. I did think that they looked at the whole thing.
Yeah, so yeah, I think sure the top programs probably look at that a little more, but I do think it is becoming more and more kind of like looking at the whole application. I will say from the Emory side at least is once you get that interview, the interviewers are blinded to your scores and everything, so it doesn't really count once you get the interview. So yeah.
I like that holistic review right there. That's very good to know. So for everybody out there, y'all are probably applying to Emory anyways, but I think this panel is even making it, more likely that everyone should really, truly, truly apply. Speaking about the application trails, so I mean, I think it's already been laid out. Neurology is not ortho. I mean, only ortho is ortho when it comes to numbers and things like that. When you guys were on the trail, about how many applications did you guys kind of put out there, and how many do you think is kind of like the average number now? I know for some specialties it's like, apply to 40, expect like 5 to 10 interviews or something like that. But how wide did you guys go?
Philippe, you were closest.
Yeah.
Yeah, I mean, I might have been more of a unique situation, maybe because I knew my home program wanted me, and I would probably I would have been happy to stay as well till I had my Emory interview. But so yeah, I mean, for me personally, I applied to like 13, I believe, but that's just my personal situation because I knew my home program. I don't think I would recommend that few. So maybe you should definitely apply to at least 20, I would say. But then again, it's a case by case basis, right? You know your application. Yeah, I would say, that if so basically, let's say your mentors are telling you that you have a really, really strong application, then you definitely don't need to apply to 50 programs, But if you know that there are certain things that could be improved, then that's when you can consider doing more. So
Yeah, I
Yeah.
think oh, go ahead.
No, go ahead.
Oh, I was gonna say, I think I applied to 30 programs because I knew that I could stay in my home institution, but I also wanted to try and get out of Texas and like leave and explore something else. Um, and then I ended up getting interviews at like maybe half of them, I believe. But I will Flea brought up a good point. I also would say that if you talk to your deans, because I mean we had like a dean's meeting, whatever, and they give advice for us too, but I think that sometimes um talk to your deans and then see what they think would be based on your application would be a good amount of places to apply to. And then also as well talk to the residents as well at your home institution to figure out, you know, like that those interns, like how much they apply to as well, mainly or as well as if you have any mentors, because it's just great to get different people's opinions, but also like what some, like for instance, if your person is really into research and things like that, and then you're not research heavy, they might think that you don't have a strong application, right? So it's just one of those things where it'll be good to your mentor and the deans and everything, people who know you, who know your application, just kind of talk to them to get a sense of like, okay, do you think my application is strong enough based on this? How much do you think I should apply to, etc. And they can be really helpful.
Yeah, I agree that basically I feel like it's wouldn't be wise to have like a number because it's so application specific and someone may not need to apply to as many versus, you know, based on their preferences, their application, like, you know, maybe you're in a situation like Philippe where it's like, listen, I'd be happy to stay here and I, you know, I don't, and I know I can stay here. And so why spend the money on applying to every program versus someone else who may know that there are weaknesses in their application and they want to spread a large net. So I agree, just ask around but just the only thing I would say is try not to do things out of fear because I've also seen people who like have great applications and they still apply to like every program because they're just so anxious and scared. And so if people are telling you you have a strong application and you're good, like believe them, you know, because it costs money. And so it's like, why waste the money? And it's just, you know, I feel like the application / interview season can be very anxiety provoking in general. And then I feel like match is a whole cluster of anxiety depending on your situation. So it's like, just don't add to it if you can avoid it.
All right, y'all. See that? Take some time. Let's woo-saw. Let's decompress. Like Dr. Daniel did. I think that's very great. Do what's best for you. I tell people all the time, this match game is no holds barred and nothing is guaranteed, right? So his home program said, you can come here, you're number one. And he still ranked a program that he wanted to be at, where he wanted to go. So don't feel trapped or locked in having to rank something number one, because they'll always be there on the list, is what I always say. And then you'll really see the truth. I was mentoring someone in EM who interviewed somewhere and that program was in the SOAP and he was in the SOAP. And it was just like, and then they interviewed him during the SOAP and he was like, what are we doing here? Like we were both here. So the match game is crazy. Just know that everyone up front. I want to dive into just for a couple seconds on a couple of the changes to kind of see if we can woo-saw some people out there. And I know you guys may not be thoroughly involved with the changes. You may know a little bit about them. You may know a lot about them. You may not know nothing, and that's fine. We can always redirect people where we need to. But this year, ERAS has introduced signaling, where every applicant gets 5 tokens or 5 signals to send to programs that say, hey, I am very, very interested in you. Programs that do not get tokens don't get any information one way or another, and people are told to not look at it a bad way. I double checked before this webinar. Neurology students get 5 tokens. And to put that into perspective, pediatrics gets 5 tokens, pathology gets 5 tokens, PM&R gets 5, family gets 5, EM only has 7, general surgery has 5. You really don't get into double digits until you're into the competitive ones. Anesthesia has 15, dermatology 28, radiology 12, OBGYN 18, ortho 30, ENT 25. So for those students out there with the 5 that they have right now, they're probably like, this is crazy. I'm about to apply to 20 programs and you're telling me to pick 5. Should they, just go out there and listen to their heart? Is there a game plan you think they should have here? Or is it just about where you want to be, send those tokens out?
And so making sure, because I didn't hear about this, so making sure I'm understanding, the token just lets the program know I'm really interested in you. So instead of people sending the email that says, hey, I'm ranking you highly, they're doing this instead.
This is basically exactly that. This is supposed to replace that email of "you're my number one, I promise." It's supposed to take that out the game. And so people are supposed to use this. And according to the research, because they were testing this out the last 2 years, some programs interview like everyone that signals there, right? Like, because they know you only have 5, so they take it as a really big deal. And some programs are like, I know you only have 5, so if you don't signal me, oh well, I'm still looking at you very closely. But this basically replaces that email. So students are wondering, should I be truthful and really signal the places I want to go to? Or should I just signal the places I think I have my best shot at, kind of like lock down those guaranteed interviews, right? Like, I'm not shading any program, but like Neurology backwater program that gets like 12 applicants a year. Should I signal them so I lock in my one interview there? Thoughts or tips or tricks? And again, there's no wrong answer because no one really knows. It's the first year, but anything you want to tell the attendees?
So what I'll start with, I guess, is not that many people who apply to neurology don't match. And at the end of the day, you're most likely going to match. And if that's the case, then that means that you should most likely use these tokens towards the programs where you actually want to go to. And what I will say about our program specifically is we really care about having residents who want to be here. And a part of that is, using whatever you have to your advantage to show the program that you want to be there. And if a token is gonna partly do that, then for us at least, you should do that. I think things get like a little more complicated when, let's say, you're applying to a really competitive specialty. Sure, you want to be safe and matched somewhere, but for neurology, most of us are going to be fine.
Yeah, and I think that the tokens itself aren't like, oh, if that school doesn't get a token from you, they're not going to interview you. So I think that if you're still using it, which we are, I mean, still using it as like just to show really good interest, and I think you should kind of like what Philippe said, like put it towards the schools that you really want to go to. Well, I did in the past. I was just like, okay, there's like a school that I'm just like, it's a high reach. Hopefully I make it bless up. And then there's schools where I'm just like, I would love going there. I feel like they might be within my reach. And then I'll kind of do those things. So if that's how you want to split it, that's fine. But I think that just putting it on schools that you're just like, oh, okay, I'm safe. I'll definitely get into it is kind of a waste of those tokens, because if you didn't do it, you probably like they would still have seen you when you applied there. So yeah, so use it to your benefit.
Yeah, I agree. I've just, in general, I feel like you should go for what you actually want. And I know there's like so many games in medicine and the journey to, in medicine, but I prefer like, this is what I want and that's what I'm going to go for versus like doing all this, like, chess just to try and match. Because sometimes people sell themselves short and they're like, oh, I know I can match at this program. I'll just be safe and I'll do that. And then they're not happy, versus like, I wanted to be at Emory. I ranked them number 1. I was really grateful to go there because that's where I wanted to go. And when times were tough, because I mean, it's not like it was a cakewalk the whole time. At least I knew I wanted to be there, versus like, there's long call, you're tired, and you're like, I don't even like this place. So I just in general am an advocate for like go for what you want, and at least you've put everything on the table, versus like in the end you might actually regret trying to play a game.
That is a major tip for residency in general. There are guaranteed more likely than the sun going down, the sun rising, to be hard days. Make sure those hard days are the place that you want to be at. First question. All right, way to knock it out the box. How how important do you guys think sub-Is are for neurology? And then how many would you recommend doing in a perfect world?
I think
So
they're very
not every program has a neurology sub-I. Mine didn't. So my sub-I was medicine. Yeah. So basically, it's more important to have letters from neurology than having a sub-I. But if your school does offer it, then you should definitely do it. But program directors know that not every school has it. So if your school doesn't, then it doesn't.
So would you guys recommend people killing for like the away sub-Is and, traveling to do them? I know that's kind of a big thing now, to try to get those under their belt.
I think if your school does not have, because my school didn't have a neurology rotation, like, well, they did, but it wasn't like a good inpatient. It was like an outpatient one. And it was a subspecialty. So if you're in a situation like mine, then I would definitely do an away. And but I don't think neurology needs sub-Is. I know like EM is like, right, you guys need a lot of sub-Is, and I know there's other subspecialties that like are dependent on sub-Is and have a lot of value attributed to them. That's not the case with neurology. I think it's more so if you don't feel like you either had a strong letter or you don't have a strong experience, then I would definitely prioritize that.
Something new.
Yeah. Same. Yeah, I didn't know. I'm talking to this one medical student right now who she's in a similar boat where her school doesn't have a sub-I, and I tell her the same thing. Like, if you have enough, because traveling to different schools is difficult if you don't have the funds to do so for a sub-I. I do know that there are some programs where, like let me not plug any program. Let me not do that. But there's some programs.
Oh no, I want to hear this. It was about to get good. All right, there you go. You're
Yeah.
back.
Good, wonderful. I saw it. I was just like, oh no. So there are programs where they'll pay for your sub-I, so you do have that option.
Okay, you're back.
It's still here.
You're
Oh,
back.
I'm about to switch back to my phone if this keeps happening. If you don't have, because my school, I was blessed. I had plentiful sub-Is and different rotations and things like that for neuro. And kind of like I said, I did it as a way to get a strong letter in neuro because I felt like with that sub-I to one-on-one so they can speak more to my character. And also I will say that really more for the sub-I. I mean, I did two sub-Is. One that was just like more of a general neuro, and one was like I see. I was just like, okay, I want to know that I can do work in different. By all means, go ahead and have to. But I will say that your letter doesn't necessarily have to always be from neurology. Like, you definitely want to have at least one. It could be medicine. I had one from psych as well. So wherever you can get a letter where they can speak to your skills and your character, that would be helpful. And yeah.
Neurology is really forgiving in these streets. I like that. And this is why I like doing these panels, because I think nearly every specialty I end up sitting on one of these, they're like, sub-Is are mandatory, do one, get your letter, get out. But it's very nice to know that, if you don't have it, you don't have it. But it sounds like letters tend to be the heavy weight for the neurology application. All right, y'all. So go out there, get those letters. I mean, if letters are the weight, go as high as possible. We're talking chair if you can get it, department if you can get it. Look, exactly. Free to just ask. Which do you think are the strongest letters of recommendation? So I'm going to throw a curveball on that question. Would you recommend the attending you were in the trenches with, did your rotation with, were on call with them, and worked in the free clinic with, or the chair of the department that's an endowed chair? Like, which letter would you tell people is the better letter?
Yeah, something I observed is that, connections are everything. I wish I had known that earlier on in my medical career. But if you have a strong letter, not like the generic, clearly this is a template and they just put your name in, but if you have a strong letter for someone who is well known or at least known to the place you're, the places you're applying to, like, maybe well known in movement disorders, and you're applying to a place that has a strong movement disorders division, something like that. That goes a long way versus, maybe, you have a junior attending who is not, just well known in the field yet. Strong letters are always strong letters, but it goes further if people know who's writing it. Because I've definitely heard like, oh, this person has a great letter from Dr. So-and-so. Like, it's like, that's it. Your people don't have any more questions for you almost, because there's such a strong character witness from that person. And it's like, and if this person's endorsing you, then we know that you're good. So it's like there's a lot of trust that's put in the letter writers when they are, well-known people, or people who, program, like, so I would say like definitely residency program directors, because they all know each other, they go to meetings together, etc. So if you can get a letter from a residency program director, that's really good. A chair obviously is phenomenal. Or again, someone who maybe does a lot of research. It doesn't have to be like bench research, but even just clinical trials, things like that. Those people are usually pretty well known. Or people who present a lot at conferences. Now, if you don't have access to those people, it's not like, oh, now your application is worthless. But if you are able to work with those people and get a letter, I would definitely put those as a priority.
Mm-hmm. And this has nothing, it has to do with connections, but not as much for letters. I do think that I agree, connections are important. And you'll be surprised at how many people know each other, even if you were going to different like SNMA meetings and things like that. And they can actually put you in contact with different, if there's like a dream school that you want to go to, they can put you in contact with a faculty there, so you can talk to them and be like, how do I, and just get more information from them. And that honestly has some weight into, will I get an interview or not? Like, and what do they think about me? Because, they kind of talk. So I think that's very important to, continue establishing connections. And I think that in general, with your initial questions with the vice chair versus attending, I think that if you had a chair and their letter of you was very generic and you barely know them, I feel like at the end of the day, it's not that helpful. It just seems like the main thing of the letter is that, because the letter should again speak to what you're doing and how you do it. So if they're just like, this resident was great, then it's like, how is that different from a generic dean's letter? And yes, you got a letter from them, but I just don't know how much weight it would carry versus an attending who may not be like super established, but it is a really good attending who's been there for a while and people do know them. That good letter from them will carry a lot of weight. I will also say that in my program, people already knew which attendings know how to write good letters and which attendings don't. So I would say also ask around, not ask around, but like you will know who knows how to write a good letter and who will really care to like invest in you.
Big pro tip right there. Get a good letter of recommendation. Don't just ask for one. Dr. Daniel, do you have any tips you want to drop there?
So I missed the actual question. My Wi-Fi went out, but from what it sounds like, we were talking about letters. But yeah, I think it's always better to get a letter from someone who knows you well. So yeah, I'll leave it at that.
All right, I like that. So now you guys know what's qualified as the strongest, right? So if you know an endowed chair that you've done rounds with and you are doing projects with, that sounds like the best and highest letter you can get. They can talk well about you, but don't just go start asking every single chair. I do like the great tip of the residency director, because they're going to know, especially if a residency director, I've heard the best sentence you can get on a letter recommendation is, I want this person at my program, and I hope they stay here. Ooh, when people see that in the letter, they already know, like, all right. So that's what everyone should be gunning and aiming for. We have about like 8 to 10 minutes left. So I'm going to ask one more generic question, and then I'm going to open it up for you guys to kind of just say whatever spiel you want, whatever you want to make sure these students walk away with. Feel free to offer that up. And my last question tends to be certain specialties you see people apply for, and they're already thinking down the line about like fellowship. So is neurology kind of like one of those? Like, I feel like whenever I talk to like a radiology candidate sometime, they're already talking about IR, not IR. Specifically general surgeons, they're already like, oh yeah, I'm going to do this. Or even more specifically orthopedics, right? Like you talk to one of those students, they're already talking about joint or hand or whatever. Should students be thinking about neurology fellowships? What fellowships are out there? I don't think I knew about any. But I'm also, lowly EM. So please enlighten us.
I think you don't have to force yourself to know if you've worked in a certain subspecialty and you find it really interesting and that's what's motivating you or part of what motivates you to want to be a neurologist, say that. But I think sometimes when people are too like, I'm going to neurology because I want to be a like, I don't know, a neuro interventionalist, it can feel like more of a means to an end when it comes to neurology, and programs want to know that you are going to be comfortable and willing to see everything, versus like, I'm only doing this because this is my end goal. So I think it's good to bring up, I'm interested in this, but the phrase that everyone always uses, like, but I'm open to just use that. Everyone else does too, so you'll be in good company. And there was something else I was going to say. If you're going to a program and like, let's say you're interested in epilepsy and you're interviewing at a program and they have a strong epilepsy program, like that's the time to say, like, I'm really interested in epilepsy. I know that you all are doing amazing studies with this, or you all have this, epilepsy disparities clinic that I would love to get involved in. Things like that will go a long way, showing that you're interested in that specific program and what they're doing there. So that's the only other thing I'd mention. If you already, knowing the program before you interview, and if there's something that you're interested in, and kind of doing your homework on it and being able to speak about it.
All right.
Yeah, and
Yeah,
speaking on
you
that a
definitely.
little. Oh, go ahead, do it.
Oh, I mean, so you definitely don't have to know. It's not going to make a difference when it comes to your interviews and whatnot. However, let's say you're passionate about something, or let's say you work like in a movement lab. Well, that's a part of your application, and you're obviously going to talk about it because you're passionate about it. But if you're not passionate about something, then it's not worth kind of lying to say something just to say that you have an interest. And it's going to come off as disingenuous. So yeah, so yeah, for me, when they would ask me, like my answer would always just be like, I don't know yet, but I love neurology and I'm passionate about neurology. So yeah, because that was my truth. So yeah.
What?
Yeah, and one thing I was going to add is really funny because everything on my CV is mainly stroke, and I do not like stroke. But the thing is that stroke has a lot of the research that I'm trying to bring into movement and other things. So that's not that much health disparities research. So it made sense why I did a lot of stroke. But what I will say is that if you're someone who's undecided, like I was when I first started, whenever I was looking at different programs, it was very important to me that the programs I was looking for had a wide range of fellowships, so that I knew that as I'm going there during residency, I will be able to see all those things. But if you're someone who's just like, I'm gung ho about XYZ specialty, kind of like what Mima said, keep your options open um, for everything. But yeah, just if you're undecided, then just try to find a specialty where they have multiple fellowships, so you can explore.
All right. I like that. Be open. I'm open to learning. I like that. All right. So to close this out, I would like each of our panelists to give your mega pearls, your number one tip and trick. This is gonna live on the internet forever. So what would you want people to come back and watch this and be like, oh yeah, they said that was gonna be great. And especially if I can throw a caveat out there, anything y'all have to get our attendees into that Emory neurology program, that'd also be great, because again, number one, I kind of hear about place we want to go. So I'll leave it open to the panel. Please present your tips.
I would say connect with people, especially as underrepresented people in medicine, like neurology. Like there's not enough of us, period. We know that in any specialty, but there's also not enough of us in neurology, and we want us to be in neurology. So, you know, reach out to the people who you see on panels, or who, you know, if you have faculty at your program or whoever, make connections, because people are most of the time more than willing to go out of their way to help you and to provide support or mentorship or whatever. So, you know, don't try and do anything by yourself. Ask questions, connect with people, because we want to help you. We want to see more diversity in neurology. And so we're here to help, you know, and there for people who are Black, there's a Society of Black Neurologists on Facebook. It's a Facebook group that I'm pretty sure they let med students into. So I would definitely look that up. There's plenty of, you know, there are program directors, like residency program directors on there. There's lots of attendings, there's residents, there's fellows, there's people in private practice, there's lots of people there as well. So that's a resource and a place where you can connect with people. But my big thing is just make sure that you connect, ask questions, and, you know, allow people to support you, because people are here to support you, but you just have to kind of reach out and make that first connection.
I'm gonna look for the link of the Society of Black Engineers while I let someone else talking.
Black engineers.
Not engineers, sorry. Sorry. Black neurologists.
Engineers of the brain. That's what she was doing.
Oh, we try our best.
Yeah, so yeah, I think yeah, so basically neuro is a pretty small specialty numbers wise, and you'd be surprised, you know, people know each other. And yeah, there's not that many of us, and there's even less, you know, black Black neurologists as well. What I will say, what's kind of funny too, is so as a fourth year, I wasn't even gonna, so I don't think I had Emory on my list of programs. And then we had one of those sessions, and Mima was on, and she had really good things to say about Emory. So that's why I added Emory to my list too, you know? So you never know what's gonna happen, you know? Keep reaching out, keep talking to people, you know? It's a really small field, like I said. We're all gonna meet like each other, like at conferences and whatnot. So holler at us, and yeah, we're excited to meet y'all eventually. So yeah.
Wow, small world.
I don't think I ever told you that.
You didn't.
I would say, I guess my only thing is just give yourself grace. It's whenever you're here, you're applying, no one expects you to be like this superstar, you know, med student who's on the level of like a PGY4, or sorry, a fourth year resident or third year resident. At this, we're not expecting you to know, you know, of course there are some things that you should know about neurology, like basics when you go in, but like, you know, we're not looking for the next genius. We're really looking for someone who's honestly able to be trained and able to learn, and can work well with a group. And, you know, as you're looking at different schools, obviously you have your list, but at the end of the day, the education that you get at wherever you go will be good. And just try to take as much out of your residency experience as you can. And whenever you are applying, yes, there is a name, but whenever you're going and seeing how just look at how the residents act and be like, well, I feel like I can fit into these places. I think that's very important, because you can go to a high ranking name school that was on your wish list, and then you just, you know, not like it there, not like the people around there, and it's just not going to be as beneficial to you as if it was like something else that you vibed well with, because you're not going to go to a residency program that's bad and they'll be like, oh, you're killing patients. So, you know, just keep that in mind.
I loved this advice. I loved this panel. It's my first time ever doing it. I learned a lot about neurology. It's my job to wrap this up now, so I gotta start with the obvious. Thank you guys. Thank you for your time. Thank you for your energy. Thank you for being out there. I know what you guys mean. There's not a lot of you guys in neurology. The Black and brown students out there, you're joining a field that's pretty small, but they need you guys to join it to help it up. I get plenty of teleneurology consults. Plug. If y'all want to do teleneurology, y'all really help a brother out. And I can think of only one Black or brown person that I talk to on the other side of the phone. So please, it'd be great out there. Things that I think everybody should be doing right now. Attendees that are here right now in the chat, all of our panelists dropped their emails. They dropped them for a reason. Feel free to email them. The link to the Facebook group is out there. Feel free to go there. Again, program directors are in there. People are in there. A lot of y'all are on Twitter posting your face like this and saying, I'm going to neurology, vote for me. It should be on that page too. And for those who are watching this later because you're on rotations or you didn't know and you feel like you missed out and you're like, whoa, I loved it, I want to email those people, and then you can't see the chat because it's on Facebook, at Tour for Diversity on Instagram or Twitter, you DM us and say, I want to do neurology, can I have Dr. So-and-so's email? I promise we will get it to you. So we are making sure that we diversify the face of medicine. That is our mission, that's our statement, that's what we are going to do. So thank you again all to our panelists. Thank you all to everyone who attended. And I hope to see you guys on the other side of the screen consulting with me because, again, I need you guys.
Thank you for having us.
That was
Thank
fun.
you.
Appreciate you.
All right. Have a good night, everybody.
Bye.